All right, if you have digestive issues from time to time, you're not alone. It can range from discomfort to downright serious. But how do you know the difference? Dr. Haleh Vaziri is here to help us sort it out this morning. Good morning to you, and thank you so much for coming in.
Thanks for having me.
Not necessarily a topic we talk about all the time, but there certainly are a lot of people dealing with this, aren't there?
Yes, of course. There are some patients that are going to experience some GI symptoms from time to time. And the common GI symptoms would be heartburn, abdominal discomfort or pain, bloating, constipation, or diarrhea. Many of the symptoms, though, they're not serious.
Right.
They don't last long. You can modify your lifestyle and diet and improve your symptoms. But I would like to emphasize that even a common GI symptom can be a sign of a very serious underlying condition.
So don't necessarily just blow it off and think, oh, no big deal, I'll ride this out.
Exactly.
It's good to know when to check it out.
Yes,
and the other interesting thing here, some of the problems affect women differently than men, and women are more susceptible to some of the problems as well, right?
Yes, of course. There are some GI problems that are more common in women compared to men, like irritable bowel syndrome, bowel incontinence, or gallstone. There are others that, although occur equally in men and women, they have unique features in women. For example, celiac disease, a hot topic nowadays.
Certainly, with the gluten and everything else. Yeah.
Exactly. So when a woman is affected with celiac disease, they're going to have a higher incidence of having infertility and miscarriage.
Interesting.
Yes. Other things about women is many women may have some bowel changes, like bowel habit changes and discomfort and bloating around their menstrual cycle. But I would like to emphasize that not every recurrent GI symptoms is due to hormonal changes, because you may have irritable bowel syndrome or inflammatory bowel diseases and get recurrent symptoms. So do not think every recurrent symptoms is due to your hormonal cycle.
And we also shouldn't just assume, oh, if I don't have a family history of this, I'm never going to be prone. Because even, for example, during pregnancy, you can suddenly have acid reflux issues or constipation.
Yes, of course. So during pregnancy, there are two factors. One is hormonal, and the other one is a mechanical, like a pressure of a gravid abdomen. So the abdomen gets bigger, there will be more pressure on the stomach, so you're going to have more heartburn. People get more constipated during pregnancy. They may have some bleeding because they get constipated. They can have hemorrhoidal bleeding. But I would say overall, if you're pregnant and you have symptoms and you're not getting better with some lifestyle modification, talk to your doctor.
And even if you're not pregnant, if there's something that you're thinking, this doesn't feel right, something's going on, you need to know when the symptoms are worsening and when it is time to talk to the doctor, right?
Yes, yeah. There are some factors overall that I would say you should consider, so you know when to talk to your physician about your symptoms. Any symptoms overall that they're not getting better, so you are doing your share, you are staying active, you try to do exercise, you change your diet, but your symptoms do not improve or even get worse. If you're having weight loss, if you have a family history of somebody with colon cancer or Crohn's disease or celiac disease, or if you have bleeding from your rectum, I would say that's the time. This is to only name a few, but you need to talk to your doctor.
Help is available. Go get it. Dr. Vaziri,
Exactly.
thank you so much. Really appreciate it.
My pleasure.